Nurse Abigail today. We're just going to do a quick musculoskeletal in-depth focus exam. Is that all right with you?
Yes.
All right, what's your name and your date of birth?
Kathy Lane, 12/3/66.
All right, perfect. Check your band. That matches. Washing my hands, all that, closing the curtains and the door. So I'm going to ask you just some, like, your past medical history, social history, and medications. Is that all right?
Yes.
All right, so have you ever had rheumatoid arthritis or have any family history of that?
No.
What about osteoarthritis?
No.
Gout?
No.
Osteoporosis?
No.
Have you had any sports injuries?
No.
Broken bones, falls?
No.
How many packs per day do you smoke?
None.
All right, and how many alcoholic drinks do you have per week?
None.
All right, and then how much exercise do you get per week?
Like 3 times a week, about an hour.
Perfect, sounds good. And then what does like a normal diet day-to-day look like for you? Breakfast, lunch, dinner? Or do you even have all 3? I'm kidding, I want to say that.
Yes, I have breakfast, lunch, and dinner.
No, but like what's like a normal day's eating look like to you? Like what do you...
I don't know, like 5 to 6 vegetables a day. I have my dairy.
Oh, 5 to 6 vegetables a day.
I have my dairy and my
like do you eat like
fruit.
a sandwich for lunch?
Yeah, I'll eat like
you
a sandwich for lunch.
Side of fruit,
turkey.
you know? That's
Oatmeal for the morning.
Yeah.
And then
Get your grains and your fiber.
Yes.
Perfect.
Grilled chicken for dinner with broccoli.
Make sure you get your protein. It's good.
Yeah.
And then have you gotten all the vaccinations, you know, that are required and all that? And then have you ever been scanned or checked out for polio or any bone density scans? All right, good to know. So do you take any like anti-inflammatories? That could be like Advil, you know, Tylenol.
I mean, sometimes I take Advil, but not very often.
Yeah.
Just for a headache.
And then do you take any like anti-rheumatic drugs?
No.
For diseases, okay. Any anti-gout drugs?
No.
Any OTC pain, narcotics?
No.
Over-the-counter pain. That's what I wanted to say. Do you take any calcium supplements? Don't you take calcium supplements?
No, I really don't. I don't need to.
You take vitamin D supplements, don't you?
Yeah.
I don't need that.
Yeah.
And then you do any hormone replacement therapy?
Yes.
She's in premenopause. All right, so I'm going to start with the exam. Is that all right with you?
Yes.
All right, so I'm going to just start with you just walking back and forth.
Okay.
I'm going to inspect your gait.
Okay.
You just walk. Yeah, just anywhere you want.
Can you even see me walking?
Walk just that way. Just straight towards the bed. A bit closer to me. Sorry, I see it in the picture. That's perfect.
Okay.
I'll just have you stand for me. Your gait looks good. You look steady. You don't look like you're limping or anything like that. Not dragging any feet. And then I'm going to palpate your TMJ for TMJ. Will you open and shut your jaw, please? Oh, I feel it. Pause it for TMJ. Do one more time. Oh, yeah, it's clicking. Check. And now I'm gonna, you know, test flexion, extension, lateral bend, and rotation for your cervical spine, which is like your neck. So can you do me a favor and just copy me? Do that. And then just look at me now, and then go like that. And now, can you go side to side? And then can you rotate? Sorry, I know you have vertigo.
That's okay.
That looks good. Now I'm just gonna feel for any swelling or deformities or masses, and it doesn't look like it's any of that, and it doesn't look red. It looks like it's normal color. Okay. I'm going to look at your spine now, your upper and lower. So can you do me a favor and bend over for me? I'm going to feel your spine for any deformities or curvature. There is none. Okay, you can stand back up for me. There's no, I'd be under her shirt, but it would be redness. There'd be no redness, no swelling. I don't feel any masses on her back, her lumbar or thoracic. spine. Can you please go side to side with your hips like this? And then can you rotate out the hips? Like Coach Clark.
Yeah.
And then can you try to touch your toes? Touch your toes. All right, that's good.
Okay.
All right, for your shoulders, I'm gonna inspect your shoulders now. You're fine. All right, can you shrug your shoulders for me? Seems like it's got a good range of motion. No redness or swelling that I can see, and no masses or anything like that that I can feel or inspect for. Can you go like that for me? And then the other arm. And then backwards. And then, I'm making this up. I'm kidding. All right. And now I'm gonna check out your hands and your elbows. I'm feeling for any nodules or any bony prominences. Yours are a little more bony just with age, but nothing out of the ordinary for your age.
Yeah.
I'm gonna look at your fingers for any arthritis in your hands. They look like symmetric. And there's no redness, swelling, or deformation. Can you just bend? And then the other one.
I'm kidding.
Oh, I thought it was funny. Can you go like this with your hand? Does that any clicking or anything like that? No pain with any of the.
Nope. Perfect.
All right. And then I'm gonna look for your radial and ulnar heads.
Okay. Good job.
All right, we're gonna do some special tests now to test for any arthritis. So can you please put your hands like this for 30 seconds and let me know if there's any tingling or numbing sensation or pain.
You have any watch?
Yeah, I just know, you know. You just keep doing that by it goes in my checklist. Any pain or tingling yet?
No.
Yet? All right, that's good. And then I'm gonna just palpate one more time your arms just for any masses. Sorry.
Tickles.
Skin soft. Thank you. And now for your hips, I want you to bend forward, side to side. I know we already did this one, I want to do it again.
It's okay.
Can you go like that?
I need to do that.
And then like this. And then do it with the other leg. Same thing, go out and then inward. And then can you just, for your ankles, just move them in a circular motion?
Yep. There's your cracking.
I know, mine do that a lot.
Can we do it?
And then
When I'm doing something, you need to pay attention.
now I'm gonna just palpate your legs, knees, and ankles and feet. All right, no swelling, no redness, no deformities, no masses or anything like that that I can feel on the legs, knees, toes, or feet. I would measure your the leg length by having you either lay down or stand up, and I just take it from your hip down to your feet, because it could be different leg measurements for 2 different legs, you know. And then I'd measure your calf muscles to see like the girth of it. And then I have 2 special tests that I will get back to. All right, we have 2 last tests for you, and this will conclude the exam. So this is called the bulge test, and that means I'm just checking for fluid on the medial side, and if it's on the medial side, that's not good. It can, you know, be indicative of pain and other issues. So what I'm going to do is feel for fluid here. Alright, so it's negative. There's no fluid on the medial side on your right leg or knee. Alright, you're good on the left one as well. And now one more test. I'm going to have you flex it fully. Sorry. And I'm going to just have you like rotate. And then go. And then
what are we looking for?
it's like for meniscus tears or something like hidden or something like that. You might not feel until you do those movements. I'm gonna do the other leg. Sorry.
You're doing great.
I just have to go in different motions.
What, if I start crying or something, then you know?
No, yeah. No pain and discomfort though?
No.
Alright, well that's it for your exam. You did great. Everything looks great. Thank you.
Thank you. More job.